Hello, welcome back to my channel, Gloria's Space, where I discuss nursing, fashion, lifestyle, training, and vlogs. In today's video, I'll be discussing the responsibility of a community psychiatric nurse, also known as a community mental health nurse. So, if you are interested in becoming a nurse or a registered mental health nurse, this video is really for you. I have other videos coming out about mental health, nursing care coordination in the community and other responsibilities. So we're focusing on the responsibilities today. So what I will say is, in order not to miss this video, please, and other videos coming out, hit the subscribe button and subscribe to my channel. Without further ado, let's get stuck in. So a community mental health nurse or a community psychiatric nurse is a registered mental health nurse. When I qualified several years ago, we used to spend like 2 to 3 years on the ward. This could be acute wards, PQ, or various mental health wards, just to get that experience to prepare you to work in the community. But now, a newly qualified nurse can qualify, register with the NMC, and be a community mental health nurse or a community psychiatric nurse. There's more support in the community. There's more training to support the staff to work as a care coordinator, because when you work in the community mental health team, you become a care coordinator to patients who need long-term plan. Okay, so a newly qualified nurse, when they start with the community mental health teams, they start with being under preceptorship, where they are monitored, they are given more training, more support, and they shadow, most of the time they shadow experienced nurses when they are going out, just to get into that system where they know about the team itself and about the way we work, the patients that we see. So eventually, a community mental health nurse will be given a caseload. If you've got more experience, for instance, and you come straight in, you'll be given a caseload of 20 or 25 or 30, depending on the trust. You're going to be a care coordinator to patients who have mental health problems and who have long-standing mental health problems with a lot of risks that are involved, or some of them without risk, just to monitor their mental state to make sure that their care needs are met at any point. So one of the things you could do is to attend CPAs, that is care program approach, where you coordinate the care and treatment of the patient, because that's your responsibility. For instance, if a patient has a CPA coming up in the next 2 or 3 months, it is your responsibility to coordinate the care in terms of making sure that the consultant is aware of it, other multidisciplinary teams such as social worker, psychology, occupational therapist, all of them will be aware that there's a CPA going on. That means you write letters. You also inform the GP so that the GP can send some information about the patient's current physical health problems. There's a standard letter normally that we send out, but again, it depends on where you work and the trust that you work in. So when you work in the community mental health team, it is a very strong, supportive team. They support you as a care coordinator, and especially if you're newly qualified and come to our team, we really do give you all the support that you need. We explain to you what care coordination means in the community, about the patients that we get involved with, about the patient you're going to be allocated to. We show you the systems at work, that is clinical notes where they are kept, risk assessment, how often we do that. In short, you're inducted on how to become a community psychiatric nurse. And not only that, you have supervision as well, and you have the team meetings, you have the MDT meetings where everything is discussed. So to be a community psychiatric nurse or a community mental health nurse is really, really very satisfying, especially when you're working with the patient to look at the care needs of the patient, to provide the support for this patient, to work with their families. You're working in a multidisciplinary team. You're working in partnership with other people, and that will include you're working with social workers, social services, hospitals, police, housing, benefits, all sorts of people, because you're looking to meet the needs of this patient. So what else do you have to do as a care coordinator or as a community psychiatric nurse? You have to have that empathy, the qualities that make you a psychiatric nurse or a community mental health nurse or a registered nurse, really. And those qualities being, when you're working with people, you have to learn how to engage, how to have empathy, how to ask questions in order to draw out what the problems are, of the patient you're seeing. You're going to be very, very patient. You have to have listening skills. It's extremely important to listen when a patient is telling you their problems, because if you don't listen, there's no point, because you won't be able to solve the problem that the patient is telling you about. So you have to have that empathy, that listening, that being able to say, give a patient reassurance that their problems are going to be looked into, their problems are going to be solved as much as you can. So what you also do, you become quite compassionate. You have to have that compassion for people who are going through a lot of problems. You have to be respectful and respect their individuality, respect their diversity, and treat them with dignity. And you also have to provide patients with information about your service, about the medication, about whatever. Say for instance, if the person has problems with social care, where they're living is not appropriate for them, you have to explain to the patient that it depends on the service, really. Some services are integrated with social services. Some community teams are not integrated. So you have to explain to the patient that if they're willing, that you can write to social services and ask them to request for a package of care or a care needs assessment. So in that case, you're taking care of that needs. And if you visit the patient and you find out that they have other problems, then you look at the problems that you can solve in a team, and also the problems that you have to refer the patient to that service to be able to solve that service for them. You've got to work in partnership with the patient, because you have to listen to the patient's needs and involve them so that they take control of their own treatment, their own needs, what they want, what is most important to them. Because you may have a patient who you think that, the most important thing to them is just to maybe take medication, but they will tell you something different. This is very, very important to them, but if they don't think medication can help them, then you have to be, as a nurse, try and explain the benefits of medication. You do psychoeducation, you see. So you give them information so that they can make an informed decision. So when it comes to other responsibilities means that you're monitoring the mental state and medication as well of the patient. So when you see a patient, you come back. If you're concerned about the patient, you have to discuss it in MDT, or if you're very concerned, you come back to the service and discuss it with either your seniors, or you discuss it with one of the doctors there. And if there's a problem, they will straight away say, okay, we need to review this patient. So you contact the patient and arrange a review date. It could be a review for medication. It just could be a review to understand what the problems are. If the problems have deteriorated or escalated, or if the problems are getting better. So those are the sort of things that you do as a community psychiatric nurse. Medication is extremely important, because most patients are prescribed medication. And when they are prescribed medication, as a nurse, you have to understand what the medication is for, the side effects, the benefits of the medication. That is why we all have to do our medicine competency test that every nurse has to do. And as a registered nurse, you have to work within the scope of your practice. That is what the NMC states, that you work within the scope of your practice. Other things that nurses do in the community include duty work. You're on duty representing the service. When you're on duty, it means that a patient can call the service. There's a number, the patient can call the service. And because you're on duty that day, you attend to the patient. You look into the patient's name, confirm that the patient is the person you're speaking to, take their details like their date of birth, NHS number, confirm that it is. Then you look into the notes. The patient is telling you the problems. You check the notes to make sure that an up-to-date record, that you have the up-to-date record of the patient. then you can the patient. And if it's something that needs to be done straight away, then that is why you're on duty, you consult somebody else and make sure that the patient's problem is solved. If the patient is under the caseload of another nurse, all you need to do is contact the nurse and say, this person has called, one of the patients under your caseload has called, and she will take it forward. If it is a risk, then you have to escalate the risk straight away and send it upwards so that that patient is seen straight away. Then again, you have to do what is called initial assessments for patients. Initial assessment means that we receive referrals from the GP. The GP is the primary care, mental health services is the secondary care. So we receive a referral from a GP saying that this patient has presented to his clinic or his surgery and they have been having problems with, for instance, they've been hearing voices or they're becoming worried that a neighbor is trying to kill them, or one thing or the other, one problem, or they are low in mood, they've been having really low mood and they are depressed. Although GPs can treat depression, but when it depends on the severity, if it becomes so severe, it comes to secondary services because there's a lot of risk involved in all problems, but especially when somebody goes into severe depression because the person can go on to self-harm. So those are the things we are trying to avoid. In that case, when this patient is referred to us, we assign a care coordinator or a community mental health nurse or a community psychiatric nurse to go and complete an initial assessment. An initial assessment is something that is very thorough, and I will be, bringing out a video focused really on initial assessments because that is where you assess the patient thoroughly and make a conclusive decision about what the problems are. Then you present it in MDT. Then MDT will look at it in a broad level from every discipline. That is, the consultants are there, doctors are there, the nurses are there, psychologists are there, occupational therapists are there. Then we decide what is best for this patient. You will also discuss it with the patient to see if it is really what they want. And if it is what they want, then you make a plan. And in that plan, you decide this plan is going to be actioned by this person, and this plan is going to be actioned by this person. So initial assessment is something a registered nurse who is a community mental health nurse will do in the community. It takes experience to be able to get to grips with it. Initially, you start with shadowing somebody. You start shadowing, learning how to do it. But as a nurse, you do assessments in any case. So you'll be able to know how to do it. With time, just a week, 2 weeks, you get on board. And the thing is with nursing is that you always ask. If you don't know, ask. Nobody knows everything. Always ask. And somebody is always there to help you. That is why partnership working in nursing is just so good. So, in terms of supervision for the community psychiatric nurses, we do have supervision, we do have clinical supervision, and we do have management supervision. Clinical supervision is looking at your clinical work, and clinical supervision is what you want to discuss. It is really a time for you to discuss any issues you're having, any questions you need, any updates in clinical, what is happening in evidence-based practice, and also in terms of where you want to be, your continuing professional development, which we call CPD. That is what clinical supervision is all about. This is very supportive. And in terms of management, you also look at management, how you're managing your caseloads. Are you getting things done the way they should be? And that is a way where you discuss prioritizing your time management, all those things. You're really supported to make sure that it's prioritized. And in any case, you have training. You have all the mandatory trainings, all the updates, new things that come out. You have your emails every day. You'll be updated on new things. And it's important to always read your emails, check your patient's notes. And the best way to do that's for me, when I was a care coordinator, what I did every day, I'll have like 25 patients, for instance. I come in on the day, then I check through every record. I check that the risk assessment is done, the care plan is done, that mental health clustering is done, If they have a CPA, I'll check when it's due. You know, all those things, you go one by one and check everything, make sure that everything is all right. Then you move on to the next patient. You will have visits to go and visit and monitor the patients. Maybe you monitor some of them weekly, 2 weekly, 3 weekly, depending on the needs of the patient. Obviously, you go and give depot injections. Depot injections are long-lasting injections that will last. Maybe some people have like 2 weekly injection, 3 weekly, every fortnight or every 6 weeks. So you go, you have to learn how to, and as a nurse, you already know how to inject. And then you have to update your training to make sure every year that you're still up to date with your training, medication training, and depot injections. And sometimes new ones come out that are quite difficult. Then we have the pharmacy come in and train us on how to inject the new ones, how to mix it up, because they come in different ampoules, and there are different ways of mixing them up that can be confusing. But you get the hang of it straight away. And also make sure that when you're going to go give injection, you have all the necessary equipment. You have your gloves, you have your yellow bin, you have everything that you need really, for disposing the injections as well. And then you do it correctly and monitor the patient. In terms of monitoring medication, the patient is on tablets. It's when you go on visits, then you ask about their mental state, about medication, whether if it's effective, whether there are side effects. Those are the things that you check. So being a care coordinator and being a CPN is very, very rewarding, because you're helping the patient to get better. When you come back, you're recording the information, storing it, making sure that it's confidential, always talking to the patients, giving them update, giving them information, and making sure that you work in partnership with them and work in partnership with your colleagues, with the community mental health team, and during MDTs. It's such a rewarding career, and that we ask anybody who wants to become a care coordinator. It is a very rewarding career. You be a registered nurse, registered mental health nurse, you come in the community and work with people who are very unwell, and it's quite rewarding to see them get better. So thank you very much for watching. Do not forget to subscribe to my channel so that you don't miss other videos coming in. I'm going to be focusing a lot more on videos on mental health, and also watch out for my other videos on fashion and lifestyle. Don't forget to subscribe. Thank you very much, and until next time, stay blessed. Bye.